Last week, a team of Blue Ridge leaders journeyed to CMC-Huntersville, a Carolinas healthcare system facility near Charlotte, a healthcare pavilion very similar to what Valdese, our own healthcare center of the future, will become. CMC-Huntersville houses a freestanding 24-hour ER, as well as a full-service lab, a retail pharmacy, advanced diagnostic imaging services, and primary and specialty practices. Our team's leader was our Vice President of Support Operations, John Mercer.
We've got a major transition going on with our Valdese campus. It's an important transition that we want to make sure that we get right. Huntersville has been around for 2.5 years. They're doing a lot of great things there. Their freestanding ED continues to grow. They've worked on issues such as transfers from the freestanding ED to some of the larger hospitals when that care is needed. And we feel that if we can find somewhere that has successfully converted to this model and we can replicate that, then we have a much higher success rate. The idea for this trip came from one of our task force meetings, and we all had a list of questions that we had thought about in our task forces. So the objective was to go down there and to sort of talk to the leadership that's down there about how they handled different situations.
John says it was a very instructive tour.
First place that we stopped is the freestanding ED. Very nice space, very nice process and nice flow throughout the space. A wonderfully open emergency department where you have a nursing station right in the middle, so they have good eye access to all of the patients that are there. We went from there to understanding how the lab interacted with them, so we walked to the lab, talked to them about their processes, what they provided for that site, and we even talked to some about how that applied for us here at Valdese. From the lab, we then went to the radiology site there, and that is a joint venture between Charlotte Radiology and CMC University. So it's a little bit different model, but there were still things that we could learn from as far as how the patients traveled from the emergency department to get their CT done, and then what the radiology folks did as far as their transporters and getting patients from one place to another. From there, we walked around to the outpatient surgery center. One of the concerns that we've had is with Valdese having inpatient right now, but wanting to continue to have outpatient surgery over there and not having the flexibility for folks to be admitted over there, we wanted to understand exactly how they dealt with that. We even looked at a nice directory system that they have there on the wall. It's basically a flat screen video panel to where you can touch and it'll tell you exactly where you need to go in the facility. So I think there was a lot of things that we learned from that trip.
Our Director of Patient Experience, Laura McNeely, went along too. And John Mercer came away from the tour recognizing that changes such as those underway at Valdese will take time to take root in our community.
I think from the Huntersville standpoint, we learned that it just takes a little bit of time for the community to understand and for them to show up and see what's going on there. But see that we are providing emergency care there every day, and even if their care that they need goes beyond the walls of Valdese, in the future, we will be able to take care of them for whatever they need.